Good evening. Well, I was a patient having pain in the abdomen since a couple of the months, and I'm lucky that I came to the right hospital, Zulekha Hospital in Sharjah, with the right doctor, Dr Sajad, and I did a hernia operation. Appreciated Dr Sajad, as well the full team in the theater. Really, they are excellent team, as well in the ward service, very nice. So I'm so glad and happy that I operated here. Now, after a couple of the weeks, I'm really satisfied with what I did the operation, and so happy with that one, and I want to convey my experience to you all. So I would like to thank Zulekha Hospital with the full team. Thanks a lot.
As our patient mentioned that he was operated in Zulekha Hospital, Sharjah. Briefly about the patient, I would like to mention that he had come with lower abdominal pain, and I diagnosed him as a case of inguinal hernia. And I operated on him by the way of laparoscopic inguinal hernia repair. But I just wanted to share with you the experience that this patient had by receiving treatment at our facility, that is Zulekha Hospital, Sharjah. He was quite comfortable after the surgery, and he was able to resume his work immediately with very little pain. And through this patient, I would also like to reiterate the message that hernia in a patient is quite common, and there are different types of hernias like inguinal hernias or umbilical hernias or ventral hernias are commonly seen in females post-cesarean or post-delivery. Although laparoscopic surgery is a very unique and it's a safe method to perform in all of these patients, but sometimes I do tailor the treatment of these patients depending on the type of hernia they have, and it might not be necessary that all the time laparoscopic repair is the best option for the patient. Sometimes the surgery can be combined with other specialized procedures, like for example abdominoplasty, especially in the females, because along with the hernia that they have, they also do have weakness of the abdominal wall muscles. So in a nutshell, we take care of all the types of hernias, whether inguinal, ventral, umbilical, incisional. These are all the types of hernias that do exist. There is a complete treatment for all of these types of hernias, and patients can resume their work quite soon with very minimal complications. Thank you so much.